Good afternoon, and thanks for joining us for today's brand new Healthline 3. I'm your host, Courtney Butts, and Healthline 3 is where we like to focus on ways to live a healthier, happier, and pain-free life. We'll be taking your calls and answering your questions live right here in the studio today. We'll be opening those phone lines soon, but as a reminder, make sure you're in a quiet room when you call with that TV turned all the way down so that we can hear your question. That number to call will be on your screen in just a moment, but that number is 318-219-4569. And today's topic is all about TMJ. And joining us now is oral maxillofacial surgeon Dr. Ross Brockman with Willis Knighton Health. Thanks for being here.
Thanks for having me.
Absolutely. So I kind of skipped over I said the acronym. So tell me, what does TMJ stand for?
So TMJ is the joint, the temporomandibular joint.
Gotcha.
So TMJ is kind of what people will call the disorder of that joint.
Gotcha. Okay. So everyone has a TMJ.
Everybody's got two of them.
Yeah.
Yeah.
But where the issue comes is that disorder or the pain and all that.
Dysfunction and pain, yeah.
Okay. Okay, yeah. So what typically causes something like TMJ?
So stress is usually the go-to cause of it. Now, we grind our teeth and clench our teeth all the time, and we're not thinking about it even when we're sleeping, and that can be a large cause of it. But there's other things such as trauma and osteoarthritis that will cause you to start having pain and dysfunction in your joint.
Gotcha. But you'd say maybe the most common is stress?
Stress is usually at the base of it, yeah.
Okay, yeah. And I think that us as Americans, and I think Louisiana actually ranked as the #1 most stressed out state earlier this year or last year or something. Don't quote me on that, maybe. But we were one of the most stressed out, and so I believe it.
Yeah.
And that's definitely maybe a risk factor.
Definitely a risk factor, yeah.
Okay. And would you say if you're more stressed out, you grind your teeth more at night too?
Yeah, at night you'll definitely clench and grind, and even during the day, if you get stressed out enough, you'll catch yourself grinding your teeth sometimes during the day.
Right, yeah, and during our midday newscast, I mentioned that I've actually had this condition before in the past, and a lot of it was because of stress. It was right around the time I was getting married, and I was so stressed out with all the planning and stuff, and yep, it happened. It'll get you. Okay, and so how do you diagnose this disorder?
So generally in our practice, we'll take a screening x-ray just to make sure the joint itself looks clinically okay. And then it's a lot of physical exam, feeling the joint, feeling the muscles around the joint, because those all kind of play a role, and then looking at the teeth and how the teeth come together.
Gotcha.
And those all kind of come together to help you move that joint, use it.
Okay, and can TMJ or this disorder be confused with maybe other disorders, or is it pretty classic symptoms?
So it was initially thought of as ear pain. It was actually first diagnosed by an otolaryngologist, but slowly over time we've kind of realized no, it's more the joint, it's the muscles around the joint and how the teeth come together that really cause it.
Okay, and sometimes it might radiate to the ear.
Radiate to the ear, you'll get ear fullness, headaches.
Yeah, okay, it does not sound fun for sure. Okay, and so so you can have this dysfunction, but maybe there be absence of pain too?
Yeah, some people will be stuck in a state where they can't open their mouth or even close their mouth, but they won't really have pain. Still has a big impact on your life, but it's not as painful.
Interesting. Okay, so you're the expert here. You're our doctor. You're a surgeon. Yeah. So is this something that you treat through surgery? So
it is a treatment of last resort. Generally, it's joint replacement. But there are kind of more minimally invasive treatments that we do offer that can help get over the dysfunction and the pain, whether that's washing the joint space out or manipulating the disc in the joint to help it sit in a better position.
Gotcha.
Those are kind of our go-tos.
Gotcha. Okay. And so from personal experience, a lot of it, mine was from stress, but I also had 2 sets of braces and, the rubber bands, and I had an overbite, so we were trying to move things around, and shortly thereafter I had this popping noise. So do you think that sometimes like orthodontic work can...
Yeah. So the way the teeth come together, because it's a lever that you put all your force through when you're biting, it can make a big difference. So if the teeth are off even just a little bit, that can put a lot of stress on that joint.
Okay. Okay, and so the popping noise, we covered this I think in our midday news, but let's revisit that. This is pretty interesting. So that's kind of a precursor, you'd say?
It can often be a precursor, and it'll be one of the first things people notice. When you open, you'll hear a big pop, and that's the disc actually riding over the condyle of the mandibular bone and popping back into place. And it's right next to your ear, so you hear it.
Oh, right.
Yeah. But there's basically an elastic band on the back of the disc, and there's muscles on the front, and they help control it. So if there's any dysfunction or looseness or instability in the joint, that's an early sign of hearing it.
Okay, and so do people typically find this dysfunction through their routine dental visits?
Yeah, dentists are kind of the front line on this. You know, you're looking at your teeth, and it's pretty close, and if you're having pain, they're going to be the ones that first see it. And then they usually will refer it to us to take a look at if kind of conservative measures don't help out.
Right, okay. Yeah, that was in my case. I talked to my dentist about it, and he was like, yep, looks like this is what we're working with. Okay, and so when should someone worry? Like when is the severities an issue?
So if you're having trouble opening or closing your mouth, that's probably a good indication that you need to go see someone and get it looked at. Any pain that lasts longer than about a month, despite anti-inflammatory medicines and warm compresses, that's probably a pretty good sign that you need to be checked out as well.
Yeah, and after a month, it seems, you know, when you're in so much pain, you want to get better.
Yeah.
So do you see sometimes maybe people relying on liquid foods because they can't chew?
Yeah, so a no-chew diet's a big part of initial conservative treatment. So it's not the most popular things that we recommend to our patients, but it does help. It's just like if you had a sprained ankle, you wouldn't want to go run on it. Yeah,
right. And it's probably better than having the joint replacement because then you'd be on a liquid diet for probably much longer.
It's just a tough road, and you lose a little bit of the function that your God-given joint gives you.
Gotcha. Okay. And we'll get to that in just a second. I want to talk all about that process because that is an option, you know, and, you know, what you can expect through that. But what are some other of those conservative measures? You mentioned washing out the joint, so take me through that.
So we can place some needles into the joint, and we can wash the anti-inflammatory mediators out, and we can put some medicine in, whether that's steroids or some viscous materials that'll help the joint smoothly move a little bit better.
Gotcha.
It's a pretty good first start.
Okay. And then osteoarthritis, like how does that affect is it kind of random what joints the arthritis affects?
So the osteoarthritis of the TMJ is more of just a wear and tear.
Okay.
And if you use it enough, you'll get enough wear. And that's when joint replacement is much more of an option.
Okay. Is there any typical, you know, staging of TMJ?
There's a few staging techniques out there, but in the end, it's much more about is the patient able to function and are they in pain? That's kind of what really determines what steps you're going to take.
Sounds like a very case-by-case measure.
Very case-by-case.
Yeah. And you're all about improving someone's quality of life, you know?
Exactly.
Yeah. Okay. Okay, so what is the most successful treatment that maybe you've provided or that there is out there as an option?
So it's very dependent on what the cause is. So if it's more of a muscular cause, then Botox in the muscles may really help somebody. If it's more of a true disc issue where the disc has a tear in it or is folded over on itself, then maybe repositioning the disc might help more. And if you have something more like osteoarthritis where it's kind of an end stage, then replacement may be the best choice for you.
Okay, so there's pain that's associated with the muscle, and is that associated with the bite, like maybe the uneven bite as well?
Uneven bite can kind of aggravate that. And then those muscles, whether it be in your neck or in your head, are all kind of connected. And a lot of the nerves that go to one go to a bunch of them. So if you have one that's irritated, it can kind of hit all of them.
Especially if you sit like this all day and you're just tense.
Tense, yeah.
You know, and sometimes if you think about it, if you're sitting there and you're stressed, you notice like I am just clenching my jaw, or even, you know, exercising a lot of times too, if someone's clenching their jaw with, you know, the force of moving heavy things.
Yeah, picking up heavy objects you're definitely going to bite down.
Okay, yeah. Do you see that more common maybe in people that are active? It's like you want to be active, but this could also be a risk factor.
We mostly see it in about 20 to 40-year-olds. That is our more active group, so it does kind of run with it.
Okay, interesting. Okay, and so we talked about surgery being that last resort. So you see that more often maybe with people who have arthritis?
Yeah.
Yeah, okay. So take me through, maybe that patient, like how old are they typically? When does it start? And maybe when do they have to consider this? I know it's individual, but.
Individual for lots of reasons, but I mean, generally if you failed these forms of conservative treatment and we're getting to the point where you're just worn out, then we talk about surgery. And these are big surgeries, but they're also done through a very minimal incisional kind of design. So you're talking about a facelift incision essentially, so you can hide the scars, and you replace that part of the mandible, which is the joint, with either a custom or a stock joint, and those will last a very long time.
Gotcha. Okay. And so the surgery, like take me through your process as the doctor. So like somebody comes to you, but they've tried all the conservative.
We've tried some conservative things. The biggest thing is working with insurance companies.
Oh, okay.
Unfortunately, in our state, there's quite a bit of exclusions for people that have TMJ problems. But if we can get the insurance companies to cooperate, we can kind of work you up. And a lot of that is going to be, at least for the custom joints, scanning and fabricating a joint that's custom to the patient. It'll match their other side and function like their other side as best as we can. And that's unfortunately done by one company in the United States, and it takes about 3 months to make.
Okay.
But once it's made, then you go in for a surgery, you're put fully asleep. We'll either have you in braces, or we'll put some braces on you at the time of surgery to get your bite correct. And
like braces that
they're not as nice as the orthodontist braces, what we use, but they're stronger, and
gotcha.
that allow us to make sure your bite's well. And then we take you to surgery, take that piece of bone out, put the custom joint in. You'll wake up and usually spend one night in the hospital with us just to make sure your pain's controlled. And then you can go home the next day on a soft diet.
Gotcha. So the material of this custom joint, can you tell me about that?
So they're proprietary. They're
blend of things?
They're a blend of metals. They're MRI safe.
Yeah,
you can go through a metal detector.
Okay, good.
And they're not bioreactive, so you're not going to have any allergic reactions generally. Now, 30, 40 years ago, that wasn't the same, and some of these implants got a bad rap for some problems that happened with them long term, but now they're all FDA approved and
nice.
Quite safe.
Have you ever seen where someone needed both joints replaced?
Yes.
Okay.
And it's usually in people that may have a jaw dysymmetry, where we have to replace both the joints and do jaw surgery to try to get everything lined up at the same time.
Oh my goodness.
And your recovery is a little bit longer, but it's generally well tolerated.
Nice. So do you usually do, is it kind of like cataract surgery where you do one eye at a time? Do you do one joint at a time?
If they're both causing problems, we recommend just to do both of them at the same time.
Yeah,
get it
okay.
over with.
And then the jaw surgery as well, if you need to correct the symmetry.
Yeah, we can do that at the same time, get the bite the way you want, try
So
to
all you have
correct
to
some
do
of the facial features. And
nice. And you just have to recover once.
one and done.
Might be a little longer of a
A
recovery.
little bit longer, but it's not too bad. After a couple weeks, you'll be back up on your feet.
Okay, yeah, well that's good. And especially since it's not like maybe a knee or hip replacement where you're I mean, you probably don't want to go and lift crazy things where you're clenching, but what do you usually suggest maybe after that surgery, like the recovery time / when you can get back on your feet?
Yeah, the biggest thing is the swelling. So even if you think of someone to get their wisdom teeth out,
Right.
you swell up like a chipmunk. Well, the same thing. So it takes a couple weeks to kind of let the swelling come down, but you're not really restricted from doing a heck of a lot after that first week.
Nice.
No heavy lifting for a couple weeks and chewing some soft food. And that'll get you through it.
Okay, yeah, lots of smoothies and mashed potatoes and all that good stuff.
Scrambled eggs.
Yes. Well, we have our first caller on the line. Holly, thanks for joining us. And we're talking about TMJ. And what's your question for Dr. Brockman?
Well, my question is last few years, when I'm eating, my jaw is constantly popping. I mean, it's loud. It's, where everybody else can hear it as well. But it's just making a constant popping noise, anything that I, try to eat. And so I just, wonder if I need to maybe be seen by the doctor, or is there something I could do to maybe prevent that, or kind of want to...
So Holly, we generally won't treat non-painful popping, but it can be a sign that you're starting to go down that road of having some degenerative changes in your joint. So first good step might be to see your dentist and just let them look at your bite, make sure that you're opening well, make sure your teeth are coming together well, and maybe even consider making a bite splint, something you could wear at night that would help to offload some of that pressure on your joint and let that disc kind of get back into a better place.
Okay, good deal. So first check with my dentist and then kind of go from there, as long as it's
Yeah, I would
not,
let them
I'm
take
not
a look
in any
at you
pain.
first. Yes, ma'am.
Okay, good deal. Thank you very much.
Thank you, Holly. What a great question. And if you're just joining us and you have a question for Dr. Brockman, we're talking about TMJ disorder. Maybe you have this condition. It's pretty common according to the doctor. So if you have a specific question, just give us a call at 318-219-4569. And so go into what you were just talking about, the splints.
Yeah.
That's pretty interesting.
Yeah, so it's a hard acrylic splint. It's probably not something you would want to wear at night, but it will help offload your joint. And if it gives you comfort in the morning, it'll probably be something you're willing to wear.
For sure.
And it's not the kind that you can pick up at Walmart.
Okay.
It needs to be hard and acrylic and made custom for your teeth. But most dentists are quite capable of making them and can adjust them and get you through the process of it.
Okay, and so if someone knows that they grind their teeth at night, would that be something for them?
Still a great choice, yeah.
Okay, and maybe like mouth guards, do those help, you think?
So the softer mouth guards will actually cause your muscles to overreact. It's almost like you're trying to chew something at night, and it can actually do a little bit more damage than not having one.
Yeah.
So to have a custom one made by your dentist is probably the way to go.
Hey, that's really good advice. I didn't know that. So I know that it's kind of out there. You can get it at the store, these mouth guards. So it's good to know that there might be a better choice. Okay, so, and you mentioned going to your dentist. So is this something, we mentioned they can help with the diagnosis process, or at least refer out to someone like you. Can they, they do a lot of x-rays. Is this something that you can see with your routine dental x-ray as well?
So when you have kind of later stage osteoarthritis, the screening x-ray of choice is a panoramic x-ray, which most dentist offices have. So they may be able to see on that if there's any joint destruction. Gotcha.
Okay, and so with your services, this is something that you have to have a referral for to be seen by you?
Generally. I mean, we will see people with facial pain all the time without referrals, but it's good to at least try to go through your dentist and let them see if there's anything that they can spot in your occlusion that might be the source.
Gotcha. Okay, and so what if someone doesn't go to the dentist regularly?
Which never happens. Everybody goes to the dentist.
Yeah.
Everybody
loves the dentist.
Everybody loves the dentist. So if you're having chronic pain and maybe it's not getting better with some Aleve or some warm compresses, then it might be worth just trying to come in and let us take a look.
Okay. Yeah, maybe this could be a PSA. How important is it to go to your dentist? Okay.
I have a dental degree before my medical degree, so I got to keep that part up.
Yeah, okay. Do you still see patients routinely for that kind of stuff?
For TMJ kind of stuff and surgery kind of stuff, yes, but I haven't done a filling or a crown in a very long time.
Gotcha, okay. Yeah, so you usually recommend twice a year for a cleaning?
Yeah, twice a year.
Any more frequently than that, you think, or that's pretty much covers it?
Your dentist will know you and your mouth better than anybody, so they can kind of decide if you need a little extra help, but at least twice a year.
Okay, good stuff. Yeah, they can help at least catch all of this early to help you maybe get that acrylic stent, right? Is that what that's called? To help at least before you have to decide on surgery and something more expensive.
And they're great screeners for everything in the head and neck. If you're talking head and neck cancer, joint problems, the dentist is the one who's most comfortable looking inside a mouth.
Okay. So this disorder, going back to TMJ, is something that can obviously be prevented in some regard. I mean, I guess if you have certain things with your anatomy and maybe the arthritis that you can't really prevent, but what are maybe some of those things that are without a doubt preventable with this?
So chewing gum is probably our biggest causative factor. So if you're someone who has chronic TMJ pain, you need to stop with gum. That's a big one. A lot of it is just how much can the body adapt to. So if you're having these pains and you go to a softer diet and you get better, great. That's awesome. But if you keep having chronic pain and you don't get better, then that's more of a problem.
Yeah, okay, so a lot of this is kind of lifestyle factors and the stress, of course.
And there's not much we can do to control stress, and everybody's got it, but it's definitely one of the causative factors.
Right, okay. Okay, and so if you have been diagnosed with TMJ, can this be reversible?
A lot of it can be. Your body has a great ability to adapt and to heal. It's just removing that inciting factor and seeing if we can't get things better. So if it's the muscles overreacting, Botox,
right,
or even behavioral therapies can help a lot of the time. Just being aware that you're grinding and clenching and learning to relax your jaw and to let it hang just a little bit, those things can help a lot.
So letting it hang, so when you're sitting at your desk, maybe instead of holding it up, kind of opening?
Yeah, just at least relaxing those muscles, and that way you're not clenching as much.
Okay, maybe schedule a spa day.
Spa days, definitely.
Since you're giving us permission to do this, to do some stress relief. I'll be like, my doctor friend told me to do this.
Yeah,
so.
That's the twice a year that we really need.
Okay. This is good advice. And so maybe at night, I've actually heard, and I don't know if this is any merit, but when you're laying on your pillow, instead of having your teeth together, when you're laying down, to open it up to, having some space. I don't know if that helps at all. I mean, I'm sure at night you just kind of
At night you probably resolve back into whatever state you're going to.
Okay.
The bite guard takes that out of the equation. It just has you in the plane that you need to be.
The acrylic one that
the
you're
acrylic hard one, not the chewy one.
Okay.
But there's little things that you can do. Warm compresses before bed, even some muscle relaxers sometimes before bed can help get you out of that cycle of clenching and grinding.
Yeah, and a stress relieving nighttime routine too. That's pretty predictable. Even if you have a stressful day, that's something that you can look forward to. That's less stressful.
Put that phone down and go to sleep.
Yeah, the phone could be a really big source of that for sure. Okay, and so that's good news. I mean, I think some people that might be dealing with this pain right now, they think, oh my goodness, or the chronic pain too that they've had for a long time. It's good to know that it can be reversed or at least managed with some of that conservative treatment or with just lifestyle changes. Yeah. Okay, and so who is your typical demographic of people that you see with TMJ? It might be a bunch of different people, but
very active, stressed 20 to 40-year-old population, as is the most common walk-ins.
Yeah. Okay. Well, I fit the mold, and thankfully, it's been about 3 years since I've had a flare-up, and a lot of it was from stress. So that's a big one. Make sure that you are feeling less, or at least managing that stress
as best as we can.
Okay. So going back to surgery, since this is kind of what you do on a, pretty often, how often would you say that you have like a TMJ surgery scheduled on a week or months basis?
So it's not that often.
Okay.
We try to maximize the more conservative methods, but in our practice, we're probably doing at least one major reconstructive surgery a month with the custom joints. The arthrocentesis and the washing of the joints and disc repositioning surgery, those are a little bit more common.
Yeah. Okay. Any other surgeries that, I'm sure you have a lot of other surgeries under your belt that you do. Anything dealing with oral maxillofacial.
Anything above the clavicles.
Okay, good. Yeah, that's a better way to describe it. What other surgeries are you able to do for people that are watching?
Oh, so we'll do a lot of joint surgery with or without jaw surgery, and then jaw surgery. There's a ton of that in this community. And then we do quite a bit of, unfortunately, head and neck cancer surgery. It's still something that is rampant in our community. Smoking and dipping, it's very common. And then we also have another side of our practice, which is helping the children with cleft and craniofacial surgeries. So cleft lips, palates, craniosynostosis surgery where the bones of the skull fuse a little early. So we do a pretty broad scope of things.
Gotcha. And why do you think in our area we have so much jaw surgery, you think?
I think we have a lot of good orthodontists who can spot these things early and know when they actually need to get treated.
Okay.
And maybe where I was in South Florida before I moved out here, it was everybody didn't want to hear the word surgery, and they would just try to camouflage and hide things, and eventually it catches up with people.
Mm-hmm. Yeah, so surgery, I think a lot of times surgery can be scary, you know, and there's always maybe a risk when you go under the knife, but in your opinion, how has surgery maybe changed the lives of patients that you've worked with if they didn't do it?
Yeah, I mean, there's so many from the little kiddos who have cleft and craniofacial where it completely changes their lives. And having worked overseas and mission trips and stuff, we see these kids not get that same care. It really shows you how lucky we are to be in a society that takes care of our kids like that.
Yeah.
And then you got joint surgeries where people are debilitated. I mean, eating nothing but smoothies and scrambled eggs for years and years, or not able to open their mouth and have a full conversation. And then the head and neck cancers, you're taking someone who's just gotten the worst news they possibly could have and trying to get them to a place where they're going to be cured and be fully restored where no one can really tell that they've had that surgery.
That's awesome. That's awesome. So it really, you just can't put a price tag on better quality of life.
Yeah.
Yeah. Awesome. Okay, so back to TMJ, what happens if it's left untreated?
So left untreated, a couple things. One is, if pain's there for long enough, it can become centralized, where even if you do treat the causing factor of it, they're still going to be predisposed to have chronic pain. And you can treat everything maximally and to the best of your ability, and patients are still going to have pain that's just not treatable with any current surgical techniques.
Oh, wow.
And that's when we have to get our friends in more of that neurology setting to help us out with things like that.
Okay.
And then the other thing is degenerating to a point where you're not able to open or you're not able to chew anymore. And then just having points where you're in chronic pain where narcotics really don't help. So it can get to a point where it's pretty debilitating.
Wow. Okay. And it's just kind of that buildup of the chronic pain over time.
Yeah.
Yeah. Okay. So really reiterating the point that the conservative treatments, whether that is the things that you offer or if it's just lifestyle factors, and even if you say even at some point there's so much pain that there's not much that you can really do other than maybe surgery sometimes wouldn't even
may help with some of the dysfunction, but might still have pain.
Okay, well, all the more reason to go to the dentist.
Get on it.
And make sure if you do have that pain that you're getting things checked out. And of course, stress relief can help with many other things too. So, okay, so we have just a couple minutes left. So, question, switching gears now for you. Are you accepting new patients right now?
I am always accepting new patients.
Okay.
We'll never stop.
Great. And so if someone has this pain, the best course of action would be to maybe get established with your dentist and get things checked out, and then they can refer out to you.
Yeah, and then we also have a great setup through Willis Knighton where if you want to come straight through us, I'm sure there's a lovely portal that they've created because they have so many of them that can get you in.
Okay. And if they wanted to come straight to you, if they have questions or if they wanted to get established with care, what's a good phone number?
Oh, that is a great question.
Or maybe we can Google your name.
We can Google that name. I'm sure it's on there.
Okay.
But we're generally having clinics on Tuesdays for TMJ patients, so that it's a little limited in one time, but we'll try to get you in as soon as we can.
Okay. Yeah. Okay. And so so you might be booked out just for a couple of weeks, but
we'll figure it out. We'll get you in.
Yeah, but Tuesdays, TMJ, pretty easy to remember. Yeah. Okay. And where are you located?
At Willis Knighton South is our main clinic right now, and we also see patients throughout the Willis Knighton network as inpatients, so if anybody's in the hospital and they have a problem they need to get seen, we can come see you.
All right. Well, it was so nice talking with you, Dr. Brockman. Thanks for joining us, and thank you for joining us. If you missed this, you can catch this on our website at ktbs.com/Healthline3, or this will also be posted as a podcast wherever you get your podcasts. Thanks for joining us.